Well, thank you everyone for coming to our CT-NHR research rounds Wednesdays at noon. I'm Dr. Megan Aston, Director of the Center, and I would like to introduce Jemeela Thomas, an MD candidate, who will be talking about Canadian health profession curriculum and educational programs that support the pediatric to adult care transitions and environmental scan. So thank you so much for coming, Jemeela, and I'll turn it over to you.
Thank you so much for having me. I'm just going to forward to the next slide, which is my intro slide. It pretty much has the same information that you just introduced. Thank you. Today, as mentioned, I will be presenting on Canadian health profession curriculum and educational programs that support the pediatric to adult care transition. And this was an environmental scan. As was mentioned, I am a third-year medical student at the Dalhousie University Faculty of Medicine, and this is my RIM research project. And Dr. Cassidy has been my RIM supervisor for the past few years. Okay, so in terms of a general outline, we'll be going through the background, methods, results, conclusion, limitations, as well as some questions at the very end. In terms of the background, I thought some things to highlight would be some key terms initially, just so we're all familiar with the same thing. So transitions in care is when there's a transfer of responsibility and accountability for some or all aspects of patient care that occur among providers. Pediatric care in this setting is treatment specifically for infants, children, and adolescents up to the age of 18 or 25 in some cases. Adult-centered care is that comes after pediatric care, so care tailored towards adults, focusing on unique health needs and conditions, typically seen in individuals 18 years and older. And then just another word is chronic illness, so a long-lasting health condition that can be controlled or managed, but not necessarily a condition that's always cured, such as diabetes, asthma, cystic fibrosis, and a couple more. So in terms of background of my particular environmental scan, the transition period from pediatric to adult care is a pivotal and high-risk phase in the lives of young individuals, particularly for those with chronic illnesses and special healthcare needs. With advancements in healthcare, including technologies and treatments, since these have significantly improved the life expectancy and the quality of life of these individuals, it enables many pediatric patients to transition into adulthood. And then approximately 40% of children live with congenital or chronic conditions necessitating specialized care beyond what is typical for their age group. And despite these advances, there still exists a notable gap in healthcare education, particularly concerning the transitionary period from pediatric to adult-centered care. So what I sought to seek out, or the objective of this environmental scan, was to assess the landscape of transitional care education in Canadian post-secondary healthcare programs that focus on preparing healthcare providers to support the transition from pediatric to adult care. In terms of methods, just going through the PICO method, it's pretty familiar to a lot of us, starting with population. The population under study includes Canadian post-secondary institutions, specifically universities and colleges, offering educational programs in medicine, dentistry, pharmacy, psychology, physiotherapy, dietetics or dietitian courses, nursing, and social work. Both English and French programs were initially considered, but only English programs were included in the final analysis. The intervention involves identification and analysis of educational programs that report on the transition of care from pediatric to adult services, including program-specific data like curriculum details, course descriptions. The comparison, so there was no direct comparison group in the study. However, the analysis involved comparing different health programs based on their inclusion of transition care resources and teaching strategies. The comparative analysis would help categorize programs as having the presence or absence of this transition resource, as well as being able to identify common themes across different health disciplines and their stages of training. And then in terms of the outcome of this study is the identification of key themes in transition care education within Canadian health programs. And then there was a focus area derived from the thematic analysis. So just in terms of how everything was initiated, so with the literature search, I initially determined what clinical teams or allied health professionals are currently involved or equipped with transfer of care to adult services, of which a few Google searches were made to see who's currently involved. This started with me looking into different pediatric hospitals to see who is involved at that specific hospital, including BC Children's Hospital, the IWK Health Centre, Sick Kids Children's Hospital, the Children's Hospital of Eastern Ontario, McMaster, and a couple more within Canada. And through this, I was able to come up with a list of professional programs such as medicine, dentistry, nursing, etc. And I was able to create a list of the different post-secondary institutions that offered these programs. How I came up with that list was I looked at a couple of Royal College or Canadian Association websites, such as the Royal College of Physicians and Surgeons of Canada for medicine programs, the Canadian Dental Association for dental programs, the Canadian Association of Schools of Nursing for nursing programs, and so on. In terms of data extraction, for each identified institution and program, there was data that was systematically extracted, such as general information like the name and URL of the university, as well as the direct URL of the program-specific curriculum. I also got program details such as the health discipline, whether or not that program was focused towards medicine or nursing, what stage of training the program was specified towards, whether it was undergraduate, graduate, or staff, and even within that, what year of training it was. So whether it was a first year, second year, third year student. Course details included the name of the course code, the delivery method, whether it was in person, online, hybrid, the course description, as well as including direct links to the actual transition resources if they were available. And then data analysis. So after data collection, I began to categorize and move on to a descriptive thematic analysis to identify the frequency of counts of common themes and patterns among programs that included resources for teaching professionals about the transition of care. At this point, there was no assessment of the quality of the programs that were identified since I knew of no validated tools for this purpose. And this leads us into the results. So just starting off with a general flow chart that shows the selection process. So on the left side of the screen, you can see all of the programs that were included and how many schools offer these programs. Medicine is offered in 17 schools across Canada, dentistry in 10, and so forth. And then the final number was 244 programs to look through. This then went into inclusion and exclusion criteria. Resources were excluded if they were not presented in English and were only presented in French. And resources were also excluded if they did not provide a course description of what the students would be learning. They would also be excluded. So we ended up with a total number of 213 schools to analyze. This chart here, this is a table that provides a summary of the programs identified that support the transition of care for pediatric patients moving into the adult care setting. It includes information on the institution name, the course description, the link to the course, and the delivery format. As you can see, there was actually, out of the 244 initial schools and then 213 when considering the inclusion and exclusion criteria, only 3 schools were found to have resources specifically geared towards the transition of care. These three schools were the University of Regina. So they have a first-year nursing program called Health and Education Across the Lifespan. It focuses on holistic nursing care across the lifespan with an emphasis on teaching and learning principles applicable to different developmental stages. We have St. Francis Xavier. Again, this is another nursing program. It's a second-year course. This course introduces students to the care of families in transition during the childbearing and child-rearing ages. Its emphasis is placed on theories, concepts, and relational practices related to family, maternity, and pediatric nursing. And then the last school was Seneca Polytechnic, and this is a third-year course called Client-Centered Care. And this course discusses the role of home care and community service in the transition of and continuity of care. So based on these three programs that spoke about educating their students on the transition of care, I came up with three themes. Themes are like an overall gist of what information is being promoted by the course. So in terms of the holistic approach to the transition of care, here at the University of Regina, the program focused on a comprehensive approach to patient care, addressing multiple aspects of health and well-being during the transition. The second theme was family-centered care in transition, and this was with St. Francis Xavier. This program emphasized the role of families in the transition process, focusing on relational practice, ethical considerations, and cultural competence. This program aimed to support both patients and their families effectively throughout the transition. And then the last theme was catered towards Seneca Polytechnic. This theme highlights programs that stress the importance of community resources and continuity of care as patients move from pediatric to adult healthcare environments. This program, aim to integrate community services and ensure ongoing care. In terms of implications and limitations, so implications, the limited number of programs identifies underscores the need for improved reporting and documentation of transitional care interventions in post-secondary curriculum to facilitate informed decision-making regarding the design, implementation, and scalability of programs aimed at supporting transitions of care. There's also a critical need to expand the focus of transitional care programs beyond traditional fields, including more allied healthcare professionals, as we saw that only nursing really focused on the transition of care period, and none of the other allied healthcare professional curriculum had this focus. And given the complexity of care transition and the varied needs for young adults with chronic conditions, additional research using diverse methodologies, including qualitative and mixed methods, is essential to provide a deeper understanding of the factors influencing successful transition outcomes, technological barriers, and system processes as well. In terms of limitations, although our approach to searching and screening was pretty comprehensive, looking at the programs within Canada, we only included English language studies during the screening process, and this may have resulted in the omission of relevant literature published in other languages. And gray literature was not searched, or gray literature searching was not undertaken due to time constraints and the low likelihood of retrieving additional relevant studies on these specific Canadian curriculum. In terms of a conclusion and summary, so from the initial 244 programs that were looked at, 213 post-secondary programs were explored, and only 3 programs were identified to have information given around transition of care, and all 3 of these programs were within the nursing fields. And then there is a need for further development and expansion of transitional care education in post-secondary institutions across Canada would be kind of like the key finding of this environmental scan. that was a conclusion. And then I have a slide at the end just for any questions that may arise from what I just presented to all of you. And I can stop sharing. I also want to send a huge thanks to Dr. Cassidy for helping me through this entire process. I know I had many questions, and I do appreciate all of the help that I have been receiving.
Awesome. Thank you so much, Jemeela. When if people have questions, comments,
I can start.
Go ahead.
Yeah, great job, Jemeela. It's so neat to see this final product of your work. I'm curious, just thinking about the limited number of programs, right, that you found in your environmental scan that actually have a focus on transitions. If you were to give some recommendations to maybe a graduate program at Dal or the interprofessional education program at Dal, what would you recommend should be included in a course or a program related to transitions?
Yeah, absolutely. I think in terms of what, like, how to structure a course, I would say like more research would need to be put into place then. But just given an example from the three that I was able to find, these nursing programs had a lot of like lecture-based information, but then they would also allow the students to go out and practice the theory that they learned within lecture. So it was nice to kind of see, or at least read on, not actually see, that these students were learning the theory in class and then practicing. They didn't mention exactly what steps they would use to take when teaching students about the transition of care. It was more general, but I do assume that if I saw like the full syllabus as opposed to the course outline, it would be a little bit more specific in terms of detail.
I just thought it was so interesting that the only three were from nursing programs. I'm not surprised because as a nurse, we recognize how important that transition is and transitional care, but I just see it as such an interprofessional activity, right? Supporting youth going from pediatric to adult care. It's not just nursing that's involved. So I think your work has really highlighted a gap in other health profession programs, other interprofessional education initiatives for the need for more of this work. So great job.
Absolutely. Yeah. I was under the, like, I had heard from physicians who I've just been like asking very generally about whether or not they get any formal training in the transition of care. And similar to the findings of this research, it's nowhere in the medical curriculum. So it does seem to be more focused towards nursing curriculum. But even so, I went through 86 nursing programs, and from that 86, only 3 nursing programs showed.
Great.
Yeah, no, environmental scans, I mean, it's such a large undertaking, and people do environmental scans in different ways. So it's, I think, really important for us to learn from you how you did it. And what would you say worked well in your environmental scan? Would you do anything differently?
Yeah, I would say initially when I was kind of getting started in terms of like making lists of what programs to even look into, at first I was just doing like regular Google searches about like different schools in Canada. And I guess I wasn't initially as organized, but then soon found out that if I visited the associations or the colleges websites, they actually provide a lot more structured information about how to then proceed. So once I was able to find like the Dental Association of Canada, they listed all 10 dental schools in Canada. So it made it a little bit easier for me to move forward with that. So I would say it's best to go into like best to look into registered. I don't know if they're considered registered associations, but into more formal associations really makes the process a lot easier when coming up with the initial lists.
Right. Yeah, no, that's huge. And then when you went forward to look at each of the 213, did you contact people or look at syllabi or the calendars or yeah, just remind me all What did you do?
Yeah. So it was, I didn't contact anyone, no.
Okay.
It was all what was given on the internet.
Yeah.
A lot of the schools have their course descriptions available for the public to see. So I was able
Yes.
to read through all of the course descriptions. And in some of them, you would see like a little bit more detail, more in line with what was like compared to a syllabi. But a lot of the programs you were actually only able to see like the course outline or the course details, and that's where I would extract the information from.
Yeah, no, perfect. So we did something, well, a totally different topic. We were looking at nursing curricula like 20 years ago. So this is what we did. We went and looked at the calendars and the description, right? So we went
Yes.
across and we were looking at, anyways, just all sorts of information. So we gathered it, we did a publication and a presentation. As soon as we did that, we had lots of people coming from each of the schools of nursing saying, no, 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 we do this and we do that. And we're like, but it wasn't in your course description, right? So you have to really make the
Yeah.
disclaimer of, yeah, this is what we found and this is what's in writing, but, and then stuff could be being done, but just not being declared. So yeah, so you have to start somewhere. So I agree with your methods. I think it's
That's a
awesome.
great
And
point, Megan, and making that really clear, Jemeela, even in your, I'm just thinking about your report for your RIM project, making it, you can't do it all. Like this,
no,
to Megan's point, the scope can't be massive, but making it really clear, this is what you found from what you extracted, and that was the scope of the project. And, the next step or another project could be reaching out. Because Megan, to your point, there's often even like hidden curriculum, right? Where,
totally.
we teach this, we
Very
definitely
true.
teach that, but it's just not listed anywhere and not reported. So I think that speaks to your recommendation and implication, Jemeela, around better reporting and documentation and clarity around this topic. So that's a really good point.
Absolutely. Yeah. Thank you.
Great work. Yeah, any other questions, comments, or anything else you wanted to share, Jemeela?
No questions or comments for myself. No.
Yeah, no, it's a lot of work, and thank you so much for presenting this. And people will continue to watch as we post this up on our YouTube site.
Absolutely. Thank you so much for having me as well.
Perfect. Thank you.
Thank you.
All right. Wish everyone a great rest of the